This week, the CDC announced they are updating guidance on isolation and quarantine periods to be shorter than they were previously. The CDC is shortening the recommended time of isolation from 10 days for people with COVID-19 to 5 days if asymptomatic, followed by 5 days of wearing a mask around others. The CDC says this is because the majority of transmission happens early in the course of the illness. Also, the CDC says if you are exposed and unvaccinated, you should quarantine for 5 days, followed by wearing a mask. On the heels of the new guidance, there's also a surge of positive cases expected for the beginning of January after people travel and gather for the holidays. We spoke with an infectious disease specialist from Allina Health about what travelers should do next.
It's very important to know what the risk of the people you're going to be around is. If you're going to be around vulnerable people, immunosuppressed people, elderly people, then I think you do really want to knock yourself out to avoid exposing them.
Dr. Frank Rame says if you have any doubt about whether or not you were exposed or if you have symptoms, then you should get tested. There have been reports of longer lines for testing at testing centers in the metro area. The Minnesota Department of Health announced this week that Minnesota passed the 1 million mark for positive cases. The death toll stands at above 10,000. Hospitals like North Memorial Health have been on the front lines of fighting COVID-19. In this week's Newsmakers, we talk about one way the hospital has worked to mitigate the spread of COVID-19 in their facilities.
We have been approaching and hovering around capacity now for almost a couple of months. It's important to understand that we're taking great care of the customers that need us, both in our clinics and our hospitals. But anything that we can do to help reduce injury and reduce the spread of COVID will help us out while we're at high capacity.
And one thing that you guys have developed is called the SAFER approach. Can you lean into that a little bit? Tell us what it is.
So the SAFER campaign and the approach that we built early in the pandemic was a way to help us kind of cut through all of the noise. Remember back early in the pandemic where we were getting all sorts of information from lots of sources about what we should or shouldn't do to reduce the risk of COVID spread. And so our SAFER campaign is clear, it's to the point, it's approachable and very much aligned with our Health Family campaign, and it allowed people who are either coming to work or coming in for care to know very clearly and succinctly what they could do to stay safe and make sure that our facilities were safe as well. So it's the normal, right? It's masking, hand washing, maintaining social distance. But it wasn't that long ago where each of those things were quite foreign, and we all had to learn it and be reminded.
Is there anything in particular that you would want to highlight that might be very unique or creative to share?
Oh, I think what was most creative about it is just how the iconography and the how approachable it is. It doesn't matter. You don't need to read it. You can just look at a visualization and you'll know what you're being asked to do and reminded to do. And that has gone over very well across all of our facilities, and we're still using it today with slight adjustments. This campaign has been with us now for almost 18 months.
And it's got a little bit of attention.
It got a little bit of attention. It did. Modern Healthcare, which is a national industry publication, recognized North Memorial Health SAFER campaign for its efficacy in safety in our health system.
All right, and even though we are entering over a year since this all started, this continues as far as the policies and making sure everybody stays safe.
It does. The entrance of a vaccine helped us in controlling the spread of the virus, but at the same time, in our facilities, it's important that we all maintain these safe behaviors so that we can protect everyone, regardless of vaccination status.
All right. Samantha Hansen with North Memorial, thank you for being here today.
Thank you so much. It's a pleasure.
North Memorial Health Hospital continues to operate at capacity. They've also brought in a grim reminder of how devastating COVID-19 can be. Just before Christmas, the hospital brought in a refrigeration truck to increase its morgue capacity. The truck is posted right outside the hospital, and a privacy fence surrounds the vehicle. North Memorial Health told CCX News that, quote, "Our current reality calls for this assistance. We've been operating at capacity for many weeks." The Crystal City Council approved a plan to purchase and install install a new pedestrian bridge at Bassett Creek Park this summer. The current bridge is located at the center of the park near the volleyball courts. The bridge is 40 years old and it cannot support the weight of maintenance equipment, which means it's not plowed during the winter. Recreation Director John Elholm says the city gets several calls about that. The council approved a new pedestrian bridge that is 80 feet long and 10 feet wide to be installed this next summer that will be able to support maintenance equipment, so the bridge can be plowed next winter. The Maple Grove Ice Skating Loop was open and ready for skaters during winter break. The loop is more than 800 feet long and 20 feet wide, and it's located in Central Park in Maple Grove. It's open every day, weather permitting, starting at 10 a.m. Reservations are not needed this year. The warming house, where you can rent skates and get concessions, is open daily too.